Hi everyone, this is the second part of the gluteal region lecture. So in this part I am going to talk about the gluteal muscles and the blood vessels and nerves of the gluteal region. So the gluteal muscles, they are arranged into two different layers. There is a superficial layer, superficial gluteal muscles, and the deep gluteal muscles. And most of the gluteal muscles, almost all of the gluteal muscles, are covered by the large gluteus maximus. Gluteus maximus that covers all of the gluteal muscles, except there is in the upper part there is an aponeurosis which covers the gluteus medius muscle. So in the superficial layer of the gluteal muscle, it includes the gluteus maximus, gluteus medius, gluteus minimus, and also a small muscle which lies on the lateral aspect. Most of this muscle is on the lateral aspect, that is called the tensor fascia lata. So these four muscles, gluteus maximus, medius, minimus, and tensor fascia lata, these are the muscles of the superficial gluteal muscles. The gluteus maximus is the largest, heaviest, and most coarsely arranged fibered muscle of our body. It has extensive proximal attachment. Its proximal attachment is onto the ilium. This is the posterior gluteal line. So here in the ilium, sacrum, and also its fibers arises from the sacrotuberous ligament. From these extensive proximal attachments, the fibers of the gluteus maximus muscle slopes or descends laterally at 45-degree angle. And most of the fibers of the gluteus maximus muscle are inserted into a thickening of the deep fascia or the thick band that is called the iliotibial tract. The iliotibial tract or IT band, it extends from the iliac crest, and this is a thick aponeurosis, and it extends distally or inferiorly into the lateral condyle of the tibia. So iliotibial tract, commonly it is called IT band. It extends from the iliac crest to the lateral condyle of the tibia. That's why its name is iliotibial tract. It receives the distal attachment of the most of the fibers of the gluteus maximus. And the deeper fibers of the gluteus maximus are attached to the gluteal tuberosity, which is a bony prominence behind the posterior aspect of the upper end of the femur. The gluteus maximus muscle is one of the major extensor and the lateral rotator of the hip joint. The function of the gluteus maximus muscle is mainly when the force is necessary. It acts when force is necessary. For example, rising from the sitting position, straightening from the bending position, walking uphill or upstairs, and also during running, this muscle acts as extensors. This muscle is functionless during standing, and also this muscle acts briefly during casual walking. The gluteus maximus muscle, I told that it covers all of other gluteal muscle. The tensor fascia lata is another superficial gluteal muscle. It is approximately 15 centimeter long. It has its proximal attachment to the iliac crest and anterior superior iliac spine, and then it descends. This muscle lies anteriorly and laterally, but it includes into the superficial gluteal muscles. And tensor fascia lata also has its distal attachment into the iliotibial tract. So iliotibial tract is a joint aponeurosis or the joint tendon formed by the gluteus maximus and the tensor fascia lata muscle. And iliotibial tract is attached distally into the lateral condyle of the tibia. Iliotibial tract gives stability to the knee joint during extension. Deep to the gluteus maximus muscle is the gluteus medius and gluteus minimus. The gluteus medius and minimus, this has their proximal attachment into the lateral aspect, posterolateral aspect of the ilium in between the gluteal lines. their fibers converge into the same way and they go to the same destination. Distally, they are attached to the greater trochanter of the femur, And the gluteus medius and minimus, these muscles are the abductors and the medial rotators of the thigh. The gluteus medius, minimus, and tensor fascia lata, all these three are the abductors and the medial rotators of the thigh, and they receive their nerve supply. These three muscles, gluteus medius, minimus, and tensor fascia lata, get the nerve supply from the superior gluteal nerve. And gluteus maximus, the largest one and most superficial one, it gets its nerve supply from the inferior gluteal nerve. So these four muscles includes the superficial layer and the deep gluteal muscles. Deep gluteal muscles are here, and all these deep gluteal muscles are covered by the gluteus maximus. The deep gluteal muscle includes piriformis, obturator internus, superior gemellus, inferior gemellus, and quadratus femoris. The piriformis is a small triangular or pear-shaped muscle in the gluteal region, but it has its proximal attachment onto the anterior aspect of the sacrum or the pelvic surface of the sacrum. The piriformis muscle arises from the anterior surface of the sacrum and it is inside the pelvic cavity, and it forms the posterior wall of the true pelvis. Then this muscle exits through the greater sciatic foramen. See, here is the greater sciatic foramen. So piriformis muscle exits through the greater sciatic foramen from the pelvic cavity and almost fills the greater sciatic foramen. And then distally the piriformis muscle, so then it enters into the gluteal region through the greater sciatic foramen, and then distally it is attached to the superior border of the greater trochanter of the femur. Piriformis is a small triangular or pear-shaped muscle in the gluteal region, and it has a key position in the gluteal region. See, all these blood vessels and nerves, these are entering into the gluteal region through the greater sciatic foramen. And piriformis muscle also leaves the pelvic cavity and enters into the gluteal region through the greater sciatic foramen. So we can name the blood vessels and nerve in relation with this muscle. We can name the blood vessels and nerves. Superior to the piriformis muscle, the blood vessels and nerves are the superior gluteal nerve and superior gluteal artery. Inferior to the piriformis muscles are the inferior gluteal nerve and artery. So piriformis muscle has the key position in the gluteal region. The obturator internus muscle. Obturator internus muscle is another muscle which arises within the pelvic cavity. It has its proximal attachment to the internal surface of the obturator membrane. And in the pelvic cavity, it forms the lateral wall of the pelvis. And then the obturator internus muscle turns abruptly and form an angle. And then the obturator internus muscle exits through the lesser sciatic foramen. Obturator internus muscle exits through the lesser sciatic foramen, and through the lesser sciatic foramen, it enters into the gluteal region. And in the gluteal region, most of this muscle, obturator internus muscle, become tendinous. And the tendon of the obturator internus muscle is attached or reinforced superiorly and inferiorly by the gemellus muscle. Gemellus is singular and gemelli is plural. So superior to the obturator internus is the superior gemellus, inferiorly is the inferior gemellus. Gemellus means twins or pairs. So superior gemellus, inferior gemellus, superior and inferior to the tendon of the obturator internus. In the gluteal region, you will see the tendon of the obturator internus and superior gemellus and inferior gemellus. These three muscles have their distal attachment together into the trochanteric fossa of the femur. And the obturator internus, superior gemellus, and inferior gemellus, these three muscles act together as a unit. So that's why sometimes these three muscles together they call triceps of the hip. These three muscles, these are the lateral rotators of the hip joint. Another deep gluteal muscle is the quadratus femoris. Quadratus femoris is a quadrangular shaped muscle, which is the most inferior most inferior deep gluteal muscle. Quadratus femoris arises from the ischial tuberosity, and it has its distal attachment into the intertrochanteric crest of the femur. The obturatory internus, piriformis, obturatory internus, superior gemellus, inferior gemellus, quadratus femoris, all these muscles are the lateral rotators of the hip joint. These are the deep gluteal muscles. These are the lateral rotators of the hip joint. Mainly, the major lateral rotator or main lateral rotator of the hip joint is the quadratus femoris muscle. The gluteus medius, gluteus minimus, and tensor fascia lata. These three muscles get the nerve supply from the superior gluteal nerve. Superior gluteal nerve supply three gluteal muscles, gluteus medius, minimus, and tensor fascia lata. Inferior gluteal nerve supplies only one, the gluteus maximus muscle. And this gluteus medius and minimus, these are the abductors of the thigh. Also, this muscle keeps the level of the pelvis. It maintains the upper level of the pelvis when we stand on one leg. When a person is standing on one leg, the upper level of the pelvis is maintained by the gluteus medius and gluteus minimus muscle. So if there is a lesion in the superior gluteal nerve, these muscles, the gluteus medius and minimus, these will be paralyzed. And in case of paralysis of this muscle, the patient, if that patient stands on one leg, the pelvis will descend inferiorly on the unsupported side. See, this side, the superior gluteal nerve is injured and the gluteus medius and minimus is paralyzed. So when this person stands on this side, on his right lower limb, the pelvis descends on the opposite side. The pelvis descends on the left side. So if this left side of the pelvis descends, then it means that the right side gluteus medius minimus is paralyzed. And this condition is called Trendelenburg test. And this Trendelenburg test is done by the physician to test the function of the superior gluteal nerve. The arteries of the gluteal region are mainly the branches of the internal iliac artery. The internal iliac artery branches superior gluteal, inferior gluteal, and internal pudendal. These three branches are entering into the gluteal region through the greater sciatic foramen. The superior gluteal artery is superior to the piriformis, and inferior gluteal artery and internal pudendal artery enters into the gluteal region inferior to the piriformis. The superior gluteal artery is a branch of the internal iliac artery. It is entering through the greater sciatic foramen, and in the pelvic cavity, it lies in between these two nerves, the lumbosacral trunk and the first sacral spinal nerve, S1. The superior gluteal artery enters into the gluteal region superior to the piriformis. Then it gives rise superficial and deep branches. The superficial branch of the superior gluteal artery is coursing in between the gluteus maximus and medius muscle and supply both of this muscle. And the deep branch of the superior gluteal artery that courses, these branches coursing in between the gluteus medius and minimus, and they course along with the superior gluteal nerve, and they supply the gluteus medius and minimus. Excuse me. The inferior gluteal artery is another branch of the internal iliac artery. Inferior gluteal artery also entering into the gluteal region through the greater sciatic foramen, but it lies inferior to the piriformis muscle. In the pelvic cavity, it is passing in between the S3 and S4. Usually is in between S3 and S4, but sometimes S2 and S3. And then when it enters into the gluteal region, it lies superficial to the sciatic nerve. Inferior gluteal artery supplies the gluteus maximus, and also it supplies the deep gluteal muscles mainly. And the internal pudendal artery is another branch of the internal iliac artery that lies anterior to the inferior gluteal artery. It enters briefly through the greater sciatic foramen, and that is the most medial of these arteries, entering into the gluteal region through the greater sciatic foramen. Inferior gluteal artery, it crossing over the ischial spine and the sacrospinous ligament. It courses with the pudendal nerve, and then it re-enters through the lesser sciatic foramen into the perineum. Internal pudendal artery doesn't supply any structures into the gluteal region. It enters through the lesser sciatic foramen into the perineum, and it supplies all the structures in the perineum. These arteries on the posterior aspect of the gluteal region and the upper aspect of the thigh, they form an arterial anastomosis. This arterial anastomosis is called cruciate anastomosis. It may not be visible in the cadaver, but there is an arterial anastomosis in between the branches of these arteries. The cruciate anastomosis is formed by the descending branch of the inferior gluteal artery, the transverse branch of the lateral circumflex femoral artery, and transverse branch of the medial circumflex femoral artery, and ascending branch of the first perforating artery. First perforating artery is a branch of the deep femoral artery. So this anastomosis is cross-shaped, it's criss-cross-shaped. That's why we call this cruciate anastomosis. This arterial anastomosis lies in the junction of the gluteal region and the posterior thigh, and it supplies the gluteal region, and also it supplies the upper part of the posterior thigh. There are several nerves in the gluteal region, and most of these nerves are the branches from the sacral plexus. And these nerves, all of these nerves enters into the gluteal region through the greater sciatic foramen. The nerves of the gluteal region are the superior gluteal nerve, then inferior gluteal nerve, sciatic nerve, nerve to the obturator internus, nerve to the quadratus femoris, and then the pudendal nerve. All of these nerves are the branches of the sacral plexus. They are entering through the greater sciatic foramen, and all of these, or most of these nerves, are entering into the gluteal region inferior to the piriformis, except the superior gluteal nerve. The superior gluteal nerves entering into the gluteal region superior to the piriformis muscle. Already I mentioned that. And superior gluteal nerve, it courses in between the gluteus medius and gluteus minimus muscle. And superior gluteal nerve supplies gluteus medius, gluteus minimus, and tensor fascia lata. The three superficial gluteal muscles get the nerve supply from the superior gluteal nerve. And inferior gluteal nerve supply the large gluteus maximus. Inferior gluteal nerve supply the large gluteus maximus. It supplies only one muscle, the gluteus maximus. And then the posterior cutaneous nerve of the thigh. The posterior cutaneous nerve of the thigh is one of the major cutaneous branch. It also enters into the gluteal region through the greater sciatic foramen inferior to the piriformis muscle. Most lateral nerve of all these nerves is the sciatic nerve. Sciatic nerve is actually, it arises as a continuation of the sacral plexus. It leaves the pelvic cavity through the greater sciatic foramen. This is the most lateral structure. You will see that it enters into the gluteal region that lies most laterally inferior to the piriformis. Sciatic nerve is the largest nerve of our body. and it is approximately 2 centimeter wide, and it passes over the deep gluteal muscles. It crossing over the deep gluteus muscles, and then it enters into the thigh. Sciatic nerve is entering into the thigh in between the greater trochanter of the femur and the ischial tuberosity. Sciatic nerve is actually, it is formed by the combination of the two nerves. It is formed by the combination of the tibial and common fibular nerve, which bounds together by the connective tissue covering. And tibial and common fibular part of the sciatic nerve, it splits approximately at the distal part of the thigh. But sometimes the sciatic nerve can split proximally at the greater sciatic foramen. Approximately 12% cases, sciatic nerve divides right here in the gluteal region, and in that case you will find the tibial part of the sciatic nerve entering into the gluteal region inferior to the piriformis, and common fibular part entering into the gluteal region superior to the piriformis muscle in 12% cases. But most of the cases, the sciatic nerve is a single nerve, the tibial and common fibular, enclosed by a common sheath, and it enters into the thigh, and it usually divides into two branches into the distal part of the thigh. Sciatic nerve doesn't supply any structures in the gluteal regions. It supplies the hip joint, knee joint. It supplies most of the muscles of the posterior compartment of the thigh. It supplies the muscles of the posterior compartment of the leg and the muscles of the sole of the foot. Parallel to the sciatic nerve is the posterior cutaneous nerve of the thigh. And posterior cutaneous nerve of the thigh is one of the longest cutaneous nerve. Posterior femoral cutaneous nerve of the thigh, unlike the other cutaneous nerve, it lies in its proximal part, it lies deep to the deep fascia. But its terminal branches piercing the deep fascia, and that supply the skin of the posterior thigh and the skin of the popliteal fossa. Posterior femoral cutaneous nerve, it give rise branches at the distal border of the gluteus maximus. It give rise branches. These branches are called inferior cluneal nerves. Inferior cluneal nerves supply the skin over the inferior part of the gluteal region. And also posterior femoral cutaneous nerve give rise the perineal branches that supply the perineal region. The nerve to the obturator internus is a small branch of the sacral plexus. Nerve to the obturator internus supply the obturator internus muscle, and also nerve to the obturator internus supply the superior gemellus. And there is another small branch of the sacral plexus, nerve to the quadratus femoris, that lies deep to this muscle, deep to the obturator internus and superior gemellus and inferior gemellus. Nerve to the quadratus femoris supply the inferior gemellus. So the two gemellus, the superior gemellus is supplied by the nerve to the obturator internus, and the inferior gemellus gets the nerve supply from the nerve to the quadratus femoris. The pudendal nerve is the most medial structure in the gluteal region. All these nerves lie inferior to the piriformis. Pudendal nerve is the most medial one, and the sciatic nerve is the most lateral one. The pudendal nerve enters through the greater sciatic foramen inferior to the piriformis, and then it crosses over the ischial spine. See, this is the ischial spine, and this ligament is the sacrospinous ligament, and this is the sacrotuberous ligament. See, ischial tuberosity, sacrotuberous and sacrospinous. So pudendal nerve enters through the greater sciatic foramen, and then it crossing over the ischial spine, and then it leaves, or it re-enters through the lesser sciatic foramen. See, this is the lesser sciatic foramen under the sacrotuberous ligament, and then pudendal nerve enters into the perineum, and when it enters into the perineum, already I mentioned in my perineal lecture that it enters into the pudendal canal. It lies in the pudendal canal within the ischioanal fossa. in between the anal canal and the ischial tuberosity, the ischioanal fossa. And in the ischioanal fossa, the pudendal nerve and internal pudendal vessels lies in the pudendal canal. And in the pudendal canal, the pudendal nerve, it gives rise the inferior rectal branches. The inferior rectal branches of the pudendal nerve supply the external anal sphincter muscle. Then the pudendal nerve also gives rise the perineal branches, the superficial and deep perineal branches, which supply the posterior part of the scrotum, and also it supplies the perineal muscles. Pudendal nerve doesn't supply any muscles or any structures of the gluteal region. It is passing briefly in the gluteal region over the ischial spine. And it enters into the perineum through the lesser sciatic foramen, and it supplies all the structures in the perineal region. Gluteal region is one of the common site for the intragluteal injection. The gluteal region has very coarse fibered muscle, and also the large gluteal muscles gives the intragluteal injection more surface area of absorption. So that's why this is one of the preferred site for the intramuscular injection. And if the intramuscular injection is given in the gluteal region, it is given usually into the upper and lateral quadrant of the gluteal region. See, if we divide the gluteal region into 4 different quadrants, this is the upper and lateral quadrant of the gluteal region where the gluteal injection is given, intramuscular injection is given. Because the other parts of the gluteal region, there are several nerves. You have seen all these nerves are overlying in the other parts of the gluteal region. So only the upper and lateral part of the gluteal region is the safest area to give the intramuscular injection. That's all for my second part of the gluteal region lecture. Thank you for your attention.